I'm 46 years old and I'm too young for saggy brows. It's hereditary. My mother has this problem, which has started to crowd her peripheral vision. So I can feel my brow laying on my eyelid. I would love a quick cure, and I'm not willing to do plastic surgery. Fast recovery is definitely a must. I just want to feel good in my own skin.
That was Julia, and like many of you watching right now, she wanted to look younger, but wasn't ready for plastic surgery and the recovery times that can come with it. So today, we actually have 2 no-time procedures that can give you dramatic results in less time.
That's probably the biggest changes we're seeing in plastic surgery is the non-invasive stuff. So Julia's biggest complaint was aging around the eyes and eyebrows. Let's take a look at how she looked. So you can see in this photograph that she has some heaviness, a little bit of hooding over that upper eyelid. Her brow position has fallen. Kind of gives her a less youthful look, a little bit of a tired look. It makes her eyes look smaller. So what I would do normally, surgically, I would do upper eyelids and endoscopic brow lift to reposition that part of her face, give her a more youthful look. But that involves surgery, downtime of a week to 14 days. So we have an alternate solution here, and Dr. Tansey, board-certified dermatologist from Washington, D.C., is going to show us how she can bring those eyebrows and eyelids up.
Hi, Dr. Arden and Travis. So what we're doing today is Ultherapy, and it is a new non-surgical treatment option to lift and tighten skin without recovery time. And what it does is it uses ultrasound to see through the skin and then treat those deep tissue structures for lifting gradually over time. Ultherapy works by first targeting those deep tissue structures for lift. Then we come in to treat a second tissue layer for further toning and tightening. What this process does is it stimulates the skin's natural ability to make collagen. So what we see is a gradual lifting, toning, and tightening over time.
Well, this is great. So thanks, Dr. Tansey. We're going to check back in to see Julia's results a little bit later in the show. It's time to reveal the results of Julia's non-surgical eyebrow lift that we started earlier in the show. So clearly this was pretty much done in no time because it's already done.
It's done.
So how'd it go?
It was great. It was great. Just some minor warm pinpricks, very tolerable, and it was easy.
So you felt the heat.
I felt the heat.
That's what it's all about. That's if you're feeling the heat, that means it's doing something, and this is why ultimately you're going to get a lift. So tell us what we can expect to see in the next weeks to couple months.
So what we did for Julia is we treated all the way around the eye to help lift and tighten. We used ultrasound, and that ultrasound goes through the surface of the skin. What we're trying to do is stimulate the lower part of the skin to make more collagen, but that doesn't happen overnight. It can take 2 to 3 months to see the most dramatic results.
Now you just have to give it time. The inside, your body is going to do it on its own. Collagen.
Exactly.
So these are these great before and after pictures that I believe you brought.
These were supplied by Ulthera, right?
Yes, these are before and after pictures of people who have been treated before and then 3 months after their procedure.
Totally non-invasive, just doing the...
Yeah, and so what we see here, we see a lifting of the eyebrow, an opening of the eyes. People look more refreshed and awake. There's no surgery, there's no cutting, there's no scar, there's no downtime.
Love it.
I can feel the effects already.
You feel a little tighter?
Absolutely, absolutely.
Well, if you're happy, we're all happy. Thank you so much, Julia. Dr. Tansey, thanks for being here. Up next, thousands of you have taken our pledge to halt assault. And coming up, we're answering the #1 follow-up question you sent us. Is sea salt healthier than table salt? The answer is next.